So, welcome to this session on the posterior compartment, posterior compartment of arm. In the posterior compartment of arm, we see one muscle, but one muscle with three heads: head, cephalic, ceps, triceps. So that's the triceps muscle. Okay, we see one nerve, and that is the radial nerve, which will be supplying the triceps. And we see one artery, and that name of that artery is profunda. Profunda means deep. Profunda brachii. Brachium is the region which we are studying, the arm. It arises from the brachial artery. The name is profunda brachii artery. And we see one vein over here, and the name of that vein is profunda brachii vein. So one muscle, one nerve, one artery, one vein. This you will not see in any other compartment of any of the upper or the lower limb. Triceps muscle, radial nerve, profunda brachii artery, and profunda brachii vein. Before we even move ahead, we with the radial nerve, firstly we should be oriented towards some of the anatomy of the arm in the posterior region. So if we are looking at the humerus from the posterior aspect, so this is the humerus on the posterior aspect. So on the posterior aspect of the humerus, there is the origin of, suppose this is the medial side and this is the lateral side. Origin of the lateral head of triceps. Lateral head of triceps. And below that, there is the big origin of medial head of triceps. There are three heads. Two heads arise from the posterior surface of humerus. What I have drawn for you is posterior surface of humerus. So this is the medial head and this is the lateral. And it in between both of them is a groove, and that is called as the radial groove. The radial groove, which is on the posterior side. Okay. So in between this two heads is this region. This is the radial groove. Now higher up over here will be the neck of the humerus, and then there will be the head of the humerus, and here will be the glenoid cavity, and this will be the scapula. What I have drawn here is scapula. This part of the scapula is called as infraglenoid tubercle, and this part is supraglenoid tubercle. We have already seen from the supraglenoid tubercle the long head of triceps takes origin, and from a long head of biceps takes origin, and from the infraglenoid tubercle the long head of triceps. So long head of biceps from supraglenoid tubercle above the glenoid cavity of the scapula, long head of triceps from the infraglenoid tubercle. Okay, so this is the site. First head, long head from infraglenoid tubercle, lateral head from the posterior surface, and medial head also from the posterior surface. Between the lateral and medial head is the radial groove. Okay. Now you may remember some more things about the long head. The long head is going like this. Okay, getting inserted. Of course, the whole triceps is a huge muscle, and then there is teres minor, right, and the teres major. Okay, sorry, the teres minor will be still higher up, The teres major going like this, and teres minor will be above. Okay. I'll draw another diagram to show you this. This is the long head of triceps. Long head of triceps, the teres minor and teres major. So this is teres minor, minor, and this is major. This is long. So this space is the lower triangular space. Lower triangular space through which the profunda brachii artery and the radial nerve come out. Okay. And above this, here is the lateral head, here is the medial. So three heads of triceps, 1, 2, 3, and coming out of the lower triangular space and going into the radial groove is the radial nerve and profunda. One more diagram I would like all of you to revise is that we know the third part of the second part of the axillary artery when we studied. The vein is always on the medial side. The coracobrachialis is always on the lateral side. So this is coracobrachialis, this is vein, this is artery, this is pectoralis major. Okay. In the second part, there is pectoralis minor, and the three cords, posterior cord, the medial cord, the lateral cord is here. And then when we go to the third part, again we see pectoralis major. Anteriorly we see the subscapularis posteriorly with teres major and latissimus dorsi. We see the artery over here. We see the coracobrachialis laterally always. We see the vein medially always. And now medial cord is replaced by ulnar nerve. Posterior cord is replaced by radial nerve. And lateral cord finally continues as median. Okay. So now this diagram we can use for radial nerve in axilla. This diagram we can use for radial nerve in lower triangular space. This diagram we can use for radial nerve passing to the radial groove. That means its origin is here in the axilla, then it passes through lower triangular space, leaves the axilla, passes through the lower triangular space, and then after it passes through a lower triangular space, it passes through the radial groove between the lateral and medial heads. If I have to revise for you that from where does the radial nerve take origin? It takes origin from the brachial plexus. C5, C6, these are the roots. C8, T1 are the roots. All the roots unite to form trunks. Okay, so now trunks, upper trunk, middle trunk, lower trunk. Each trunk divides into divisions, anterior and posterior, anterior and posterior. Okay, anterior and posterior. The anterior divisions of the two upper, they unite to form lateral. They unite to form the lateral cord, and posterior divisions of all the three, they unite to form posterior divisions of all the three, they unite to form posterior cord. So posterior cord, its mnemonic is star, that is subscapular, upper subscapular, lower subscapular, subscapular, upper and lower. Then ST, the thoracodorsal nerve, that is now to latissimus dorsi, thoracodorsal nerve, now to latissimus dorsi. A, axillary, okay, and R, radial. So axillary has C5, C6 as root values, upper subscapular, lower subscapular have C5, C6 as root value. Thoracodorsal nerve to latissimus dorsi has C6, C7, C8. Axillary has C5, C6. But radial gets fibers from C5, C6, C7, C8 and T1. Okay. Others only carry C5, C6 fibers, which are coming to the posterior cord. But C7 is also coming to posterior cord. C8, T1 is also coming to the posterior cord. Okay. So the posterior divisions are uniting to form the posterior cord, and here I want to make a point again that anterior divisions, they supply the flexors. We have seen here the lateral cord formed by anterior divisions of the upper and middle trunk, and it was giving musculocutaneous nerve which is supplying biceps, which is a flexor, which is supplying brachialis, which is a flexor, which we have seen. So flexors are supplied by anterior flexors or adductors. Now if you see the posterior divisions, the radial nerve. Now radial nerve, posterior divisions always supply extensors or abductors. So axillary nerve supplying the abductor, thoracodorsal nerve, latissimus dorsi, which is the extensor. Okay. Radial nerve is going to supply triceps, which is the extensor. It is going to supply all the extensors of forearm. Okay. Now with that, we start discussing the radial nerve. We start discussing the radial nerve. Okay. So introduction. It is the nerve of posterior compartment of R. Also, its branch supplies forearm also. Origin from posterior cord of brachial plexus. From the posterior cord of brachial plexus. Root value C5, C6, C7, C8, T1. Okay. Force and relations. It starts in the relation with the third. The force starts in the axilla. Then it leaves axilla by passing through lower triangular space. Lower triangular space. Then after passing through lower triangular space, it then, just give me a second, let's just adjust the camera. After passing through the lower triangular space, it enters the radial groove. On posterior aspect of humerus. Okay, and then 5 centimeter above 5 centimeter below the deltoid tuberosity, it pierces and goes to anterior compartment, where it lies as the lateralmost structure. In the cubital fossa. So again, and I want to remind all of you that when we studied the cubital fossa, we say this is the medial boundary formed by pronator teres, and this is the lateral boundary formed by brachioradialis, and then there are 4 structures: 1, 2, 3, and 4. 1 was median nerve, 2 was brachial artery, 3 was biceps brachii tendon, median nerve from medial to lateral side. Median nerve, brachial artery, biceps brachii tendon, and radial nerve, the lateral most. That means this is one more diagram I can draw for radial nerve. So I have this diagram to draw, I have this diagram to draw, I have this diagram to draw, I can draw 5 diagrams if a long question is asked on radial. Okay. So now Let us start drawing the diagrams. Okay. So one diagram you can draw about its root value. We say the root value C5, C6. So draw C5, C6, C7, C8, C1. Unite them. Okay. Unite them. Then show divisions. Anterior, posterior, anterior, posterior, anterior, posterior, and all posterior. All the posterior uniting to form posterior cord, which continues as radial nerve with root value C5, C6, C7, C8, C. Okay. Anterior, this is medial cord, this is lateral. Okay. Short diagram, very short diagram. How to draw it? Now axilla. Now how is the relation in axilla? So now only third part. Pectoralis major anteriorly, subscapularis posteriorly, maybe teres major, latissimus dorsi will be also there. Axillary artery in between, axillary vein on the medial side, coracobrachialis on the lateral side, and here is radial nerve. Here is the medial side ulnar nerve, lateral side medial nerve or lateral root of median. So what are the relations? What are the relations? Anteriorly is axillary artery. Posteriorly is subscapularis, latissimus teres major, latissimus dorsi. Okay, teres major and latissimus dorsi. Laterally, here will be auxiliary nerve also. So laterally is coracobrachialis. Okay, laterally is coracobrachialis. Medially is axillary vein. Axillary vein. Laterally is coracobrachialis and axillary nerve. Coracobrachialis, axillary nerve. Medially is axillary vein. Axillary vein is here. Medially axillary vein. Laterally axillary nerve, coracobrachialis. Okay. So after leaving axilla, it passes through the lower triangular space. So draw a short diagram like this on lower triangular space. You can show the humerus. You can show long head going like this, teres minor going like this, teres major going like this. Okay. So this is the lower triangular space. So where the radial nerve is coming with profunda brachii vessels. I am writing vessels. There is artery and there is vein. Okay. So what are the relations here? Medially is medially long head of triceps. Okay. Medially is long head of triceps. Laterally is humerus. Superiorly is teres major. I have written the relations of this part. Then what happens? It enters the radial groove. So in the radial groove, what are the relations? The lateral head, the medial head, and the nerve passes like lateral head of triceps and medial head of triceps. The nerve passes like this. Okay. Now one more thing. The last thing. Then it pierces 5 centimeter below the deltoid tubercle. It pierces and goes to the anterior compartment. And then it is the lateral most structure in the cubital fossa. So again draw cubital fossa, pronator teres. I show brachioradialis. Okay. And I show the 4 structures: median nerve, the brachial artery, biceps brachii tendon, and lateral most radial nerve. So again I write lateral here, medial here, superior here, and inferior. So one more diagram I have drawn to show the radial nerve. And after that is the lateral most structure in the cubital fossa. After that it continues as posterior intraosseous nerve. Of course, in the it continues more as a cutaneous nerve, and its main continuation is posterior intraosseous nerve, which lies in the posterior part of forearm. In the posterior part of the forearm. Okay. Now coming to the branches. Coming to the branches of the radial nerve. Whenever we talk about branches of any nerve, our formula is MAC-V. Formula is MAC-V, muscular. Firstly, start with muscular. Now, in case of radial nerve, we have, whenever we write branches, we have to write branches be given before entering the radial groove, in the groove, in the groove, in the radial groove, before the radial groove, in the radial groove, after passing through the radial groove. Okay. Before entering the radial groove, it supplies the uh, long and medial head of triceps. Long and medial head of triceps. In the radial groove, it supplies the lateral and medial head of triceps. Lateral and medial head of triceps plus anconeus. After coming out of radial groove near the elbow, it supplies brachialis. Yes, yesterday we studied brachialis and we said it has dual nerve supply from musculocutaneous nerve and radial nerve. Brachialis, it supplies brachioradialis. It supplies brachioradialis and it also supplies one muscle. Now this is the first odd name you will be hearing, the extensor carpi radialis longus. Bapre. Name suggests it is extensor of the carpal bones. So these are the carpal bones. So it suggests extension of the wrist. It is attached to the carpal. So when carpals extend, there is extension of the wrist. Extensor carpi, radialis, it is on the radial side, on the lateral side. And longus, because there is one more muscle called extensor carpi radialis brevis. Brevis means small. Okay, so these are the muscular branches. Before radial groove, long and medial head of triceps. In the groove, lateral and medial head. After the groove, supplies brachialis, brachioradialis, and extensor carpi radialis longus. MAC-V, A articular. Articular branches are given mainly to the elbow joint. Then, so it supplies triceps, and triceps is the main extensor. It is the main extensor of the elbow joint. It also has it supports the head of the humerus inferiorly, and it, in case of shoulder joint, supports some support on the inferior aspect. And in case of elbow joint, it is extensor, and also there are some fibers attached to the capsule of the elbow joint, which prevent the crushing of the elbow joint when we extend the elbow. Then cutaneous branches. So before the radial groove, there is a cutaneous branch which is given posterior cutaneous nerve of arm. In the groove, in the radial groove, there is a branch given called as lower lateral cutaneous nerve of arm. We have already seen that upper lateral cutaneous nerve of arm was given by axillary. Lower lateral cutaneous nerve of arm is given by the radial. Vascular branches are given to profunda brachii, artery and vein. Okay. Now let us study the applied anatomy. The radial nerve is when you write applied anatomy of nerve, we have to write about the lesion and how the lesion takes place. So radial nerve damage can take place in IM injections. So in case of females, IM injections are given in triceps many times, in especially a country like India, where the females wear a very tight blouse. So it is very difficult to give injection on their deltoid. So injections are given in triceps. It's not that every time there is injection given in triceps, the radial nerve is damaged. Only thing if the injection is not given properly, it can happen. Then Saturday night palsy. Why they use the word Saturday night palsy? In the Western countries, many people drink on Saturday nights and then they sit in their chair and they sleep there. And then the radial nerve gets compressed. It gets compressed by the sidebars of the chair. Okay. So when this happens, Okay, what will happen? The triceps will get paralyzed. So extension will become weak. Extension of the elbow becomes weak. Okay, extension of elbow is weak, and main the extension of the wrist becomes weak, and therefore it leads to wrist drop. Okay, the radial nerve further supplies the muscles which extend the wrist. So if these are paralyzed, the wrist drops like this. Okay, that is called as a wrist drop. Saturday night palsy. Now IM injection, if in now here also there is a difference. So if the injection damages the radial nerve in the groove, still the majority part of the triceps is supplied. This is asked in the exams. Before entering the radial groove, only it has supplied long and medial head. So in the radial groove, if there is a damage, the triceps will become slightly weak, but still the extension is possible. But in case of Saturday night palsy, there is a wrist drop, and the extension of the radial nerve and the triceps muscle, which is the chief extensor of the elbow. And there is one muscle, one nerve, one artery, and one vein in the posterior compartment of the arm, profunda brachii vessels. And the profunda brachii vessels also take part in the anastomosis around the elbow joint, and it gives some of the branches like radial collateral and middle collateral. It gives also one nutrient artery to the humerus, but radial collateral, which is called as anterior descending, and middle collateral, which is called as posterior descending artery. These are some of the important branches of the profunda brachii, but you should know that profunda brachii is the main artery supplying the posterior compartment of the arm. So with that, we end our session. Thank you so much.